So first we'll talk about week one a little bit. I just wanted to mention the pre and post quiz. I heard from a few people, but not many. So, as you read, the cases were quite short. They didn't give you a lot of information. So don't fret, don't freak out. If you didn't do well, the point of the um, class is to learn. So hopefully your post quiz will be a little better. Um, One other point that I wanted to make about that, when I said immediate referral versus treat and refer, immediate referral um, is some type of condition, something that needs to be addressed right away, because delaying um, treatment will put the patient in danger. So that's what I mean by immediate referral. So things like MI or DVT or cauda equina are all um, immediate referral type conditions. So what you can do is go to chapter 20 in the book, and this is a chapter called Do Not Miss Conditions. And that kind of summarizes all these types of immediate referral conditions. I think I have it in the syllabus for you to read later on in the course. But for right now, you can get an idea, and that might kind of put things in perspective. Okay, so I just also a couple other things. So I emphasized direct access when I was doing my introduction, but keep in mind that I'm just going to call him Dr. B, Dr. Boysenall, mentioned, even patients who are referred from physicians, you still need to be aware that there might be conditions that have been missed. It may have been a while, like he was saying, that they've seen the physician, or things have cropped up. So you still want to be cognizant of that. Don't take it for granted that just because they've seen the physician, that they're only a musculoskeletal patient. Okay, treat every patient the same. All right. So the main idea of week one was taking the medical history questionnaire that you usually fill out in outpatient settings. If you're in a rehab setting or acute care, of course, you won't have that. But again, in rehab, in a SNF, something like that, you still want to be on the lookout for all these types of conditions that cropped up, all these type of non-musculoskeletal conditions. Granted, there are other medical personnel around, nursing all the time, occupational therapy, physicians, but it's still a good idea to be vigilant and look. Again, this was about the medical history questionnaire that you're going to fill out. As you know, there are sections on past medical history, present medical history, family history, medications, hobbies, things like that. Just going back to the past medical history. So it's on there. You still need to ask them questions. You still need to follow up. If they marked a box or checked off something, you still need to probe and ask further questions about that. Just because it's on the questionnaire, don't assume that's all that's all the information you need. Same thing with the medications. They'll write the medications on there. Make sure that the patient knows what they're taking the medications for, and that you know what they're taking the medications for. There are some medications that are used to treat other conditions rather than the main purpose, like beta blockers for depression, things like that. Okay, so really the main idea, and then which is consistent through the course, is for you to probe, for you to ask more specific questions, for you guys to get into the habit of really getting to the bottom of things, and of really getting all the information that you can. I noticed that during that Judeo Day, some of you weren't taking as specific histories as you should have. You weren't asking enough questions. Okay, so that's part of what this course is for, to get you to do that. Week 2 is more about the patient's story, about their chief complaint, about their actual pain complaint, what they're telling you, and then how to decide if it's typical or not. So I think you need to think of in terms of what is a typical musculoskeletal complaint like versus what an atypical complaint is like. So if you know how a musculoskeletal complaint should act, if you know what should happen, um, types of patterns that should occur, reproduction of pain during movement, unloading versus loading, what happens at night, what happens during a 24-hour period, how a normal musculoskeletal condition should react, then you can kind of then you'll be able to tell when it's not typical. So that's kind of what this week is about. There are, in the lecture, Dr. B talks about visceral pain patterns, and there's a couple of slides about it, but that's not enough. Okay, there is. It is discussed in the textbook, so you need to read the textbook, and then the 3 articles I posted in Canvas for this week. You need to know those. Okay, you need to read those. Those are important. Those will be on the test. The pathological origins of trunk and neck pain, all that stuff is fair game. You do have an assignment this week. Your first assignment, it's a Hello Dr. Lebowski assignment. Excuse me. I've given you some information, and I want you to think about how you would present it to a physician. Okay, so this is information that maybe the physician, Dr. Lebowski, didn't see. You're presenting your findings of your exam because you're concerned about a specific problem. Okay, so part of this class and part of being a PT is knowing how to communicate not only electronically, but definitely verbally, how to communicate with other medical professionals and convey your concerns or your information in a succinct, efficient manner. Okay, so that's kind of what this assignment is about. That is it. That's all I got for this week. Everybody have a good week. If you have any questions, feel free to call or email. Other than that, I will see you soon. Okay, bye.